Hi everyone, welcome to this K9 Health webinar. Thank you to Jessica Crate for asking me to be on to tell everyone a little bit about K9 Health. She's doing a great job by hosting these weekly webinars, having different guests on, talking about all the various products that LifeVantage has to offer, and she asked me to speak a little bit on K9 Health. So I'm very thankful to her for asking me to do this, and hopefully this will provide some good information for you all out there as you're sharing the products and talking to different people about what these amazing products do. And so my name is Allison Parnes, and I am a veterinarian. I've been practicing for the last 14 years in the Atlanta area, graduated from the University of Georgia in 2002, and went on to do a small animal internship in medicine and surgery at Georgia Veterinary Specialists, and then got my certification in acupuncture back in 2012. So currently I work in an emergency practice as well as a general practice, and I do some work with the Humane Society and help them with their spays and neuters and surgeries, and then I also have an acupuncture practice. So very diverse work that I do within the veterinary field, but I love it and wouldn't have it any other way. I am also a mom and a wife. I've been married to my husband Mike for 16 years. We have two boys, Zion and Donovan, who are 9 and 12. Just skip to that slide. That's them, it's my family. I have two dogs, a husky and a lab, and then I have two cats. My one cat is a scaredy cat, so I can hardly ever get any pictures of him, so he's not up here. But as you can imagine, we're very busy. And so tonight, I'm just gonna share my story about how I came to know about LifeVantage and why I'm so excited about it, and then educate you a little bit on the science and what K9 Health does for our pets. So about 6 years ago, I became really interested in alternative medicine. I was working in a general practice at the time, and I was really just kind of getting discouraged. I was having a lot of clients coming in with their dogs who were older, sort of in the end stages of life. We're having a lot of quality of life discussions, and patients that were maxed out on medications for pain, and people just not ready to make that decision to let them go, and asking me if there was anything more we could do for them. And I just really didn't have a great answer, and it was just a very frustrating place to be in. I just felt like there should be more we could do, and I just didn't have that knowledge. So I was also, at the time, diagnosing a ton of cancer in dogs. Probably 3 to 4 cases a week was a norm, and it was in dogs of all ages. And that was really scary. And the most common thing that people would say or ask is, what could I have done to prevent this? And my answer was always, there's nothing you can do. It's unfortunately the world we live in. I mean, cancer is rampant in people and children, and it's just sad. It's just really a state of our environment in most cases. And so, then I had people that would come in and just dump supplements on the counter and ask me if this was safe for their dog to give to them. And, a lot of times I would look through there and I didn't really know what some of these things were. I didn't know if they were safe. And so I just really couldn't offer them any great suggestions in terms of herbal medicine. So I was really looking and searching and open to learning more because I was seeing the need from my clients and, and wanting to be able to give them better information. I was also kind of going through a very serious situation with my family. In 2009, both of my sons were diagnosed with a kidney disease, and my oldest son, once we found out, progressed very rapidly and went into kidney failure when he was 6 years old and had a transplant when he was 7. And my youngest son was diagnosed as well, and they told me there was really no cure, no treatments that they could offer, and that just to really prepare myself, that he would probably go into kidney failure around the same age as my oldest son. So they really left us with no options in terms of treatment. So as you can imagine, kind of going through what, I'm seeing in my career in my veterinary practice, and then also having this happen to my family, my mind was completely open to researching alternative medicine and herbal therapies. So my first step was actually I decided to take an acupuncture course, get training in that, and then I became certified in veterinary acupuncture in 2012 and was introduced to a number of different, a little bit of herbal medicine in that training course, and definitely opened my mind to some other treatments that were available for both my patients and possibly my children. And about a year and a half ago was when my best friend from vet school, Sheridan Pate, called me, and she was living on Oahu at the time, practicing integrative medicine. She also does acupuncture, so she sees a lot of the older patients that I do, a lot of chronic pain patients. And she called me one day and asked me if I'd ever heard of Protandim or Canine Health, and I said no. And she said, well, I really think I found a way for us to help our patients. And she said, I want you to watch this ABC primetime video that was done on Protandim back in 2005, and then go to PubMed, and there's all these studies. You can read through the studies. And so I did that, and I, was just blown away by the research that I saw on PubMed on Protandim. And as I'm reading some of these studies, I'm thinking, well, yeah, this looks awesome, for not only my patients, but possibly my son, who's still, dealing with this kidney disease, and my mom, who's got all kinds of other health issues. And I thought, this is something that I would really like to try, and, to have my family and try, a couple of patients on this. So I decided to start my son on it, my mom, and two of my patients that were both dealing with a lot of chronic health issues and pain and mobility problems. And I was just absolutely blown away by the results. In a very short period of time, saw dramatic changes in my son's lab work, dramatic changes in my patient's mobility for the better, and to the point where, eventually we were able to wean one of my patients completely off of pain medication. My mom had some really great results as well. And so I was just all in. When I saw that, I really needed to see that proof that it was working, and seeing the science behind it too, for me, was just key, because, I really need to understand what I'm giving to my patients, what I'm recommending, and I want to, be able to back those things up. And especially if I'm going to put my name behind it as a doctor, and give it to my children, I wanted to make sure this was absolutely bulletproof. And so once I saw what I needed to see and did a lot of research, really, it was a no-brainer for me. I got into the business really in the beginning just to be able to provide the product to my patients at the clinics I was working at. But it has definitely turned into a lot more and blessed our family tremendously. So tonight what I'm going to do is just get into a little bit of the science and really tell you what this is and how it works and how it can help our pets. So the first thing I want to start with is oxidative stress. And, some people hear that word and think, oh, it means you're stressed out. And oxidative stress, really, it is a stress, but it's a stress at a cellular level. And basically what it is when you breathe, when you eat, when you drink, pretty much anytime you're utilizing oxygen, you're burning oxygen, and it's creating these free radicals in your body. And free radicals are unstable molecules. They go around attacking your cells, trying to become stable by stealing electrons from other cells, and it causes cellular damage. Our bodies fight back with a system of enzymes, but as we get older, those enzymes decrease. And when that happens, you have this buildup of free radicals in the body, and that causes cellular destruction and is also the reason we age. So you can see that normal cell there, and over time, what happens to that cell as a result of oxidative stress. It's the same process as browning of the apple and the same process as rusting of metal. And this has actually been calculated that the average person burns or produces 300 sextillion free radicals every single day. So it's an absolute huge number. And, so once that builds up, we really need an effective way to be able to lower that. And so how do we fight oxidative stress and free radical damage? Well, there are two ways. There are the direct antioxidants, which are your juices, your fruits, and your vitamins, your red wine, chocolate, blueberries, everything you can really think of that's out there on the market. And, your vitamin C, your vitamin E, and these are direct antioxidants. You take them and they work on a 1-to-1 ratio. One vitamin E will neutralize one free radical. Our other way to combat oxidative stress is through our own natural enzymes, and these are known as indirect antioxidants or endogenous antioxidants. And these are the enzymes that our body makes. So SOD, superoxide dismutase, catalase, and glutathione are the three big ones. There are more, but these scavenge free radicals by a million per second. And so you can see when you're talking about a huge difference here, and when you're talking about working on the 300 sextillion number, do you want to have something that's fighting them 1-to-1 or 1-to-1 million? So obviously our enzymes work much better than anything that we can take exogenously, like our vitamin E, vitamin C supplements. So this is what's so great about Protandim, is that Protandim is not an antioxidant. It's not one of those indirect antioxidants. What it is it's an herbal formula. It's made up of 5 herbs, which we'll get into. And these herbs stimulate a pathway in our body called NRF2. And this NRF2 pathway actually communicates with our DNA, and it causes us to start producing our antioxidant enzymes in high numbers. And so as these enzymes are being kicked out, they are scavenging those, 1 million free radicals a second. And that is how we get this huge reduction in oxidative stress. So Protandim was proven in a human clinical trial that in 30 days of a person taking it, it reduces oxidative stress by 40%. So this is a huge deal. It's the only thing that's ever been proven to do this, that's all natural and safe. It has the peer-reviewed science, it has the NSF seal, and it's also BSCG certified for professional athletes. So it's an incredible product, really a category-creating product on the fight against oxidative stress. It's made up of these 5 herbs. We've got milk thistle, which is very powerful, liver cleanser, detoxifier. There's bacopa, ashwagandha, green tea extract, and turmeric. All 5 of these are known as superfoods. They're all very powerful by themselves, but it's the way that the extracts have been combined in Protandim that makes them so powerful in terms of activating this NRF2 pathway. And so taking these herbs in any combination or just taking 1 or 2 of them, you're not going to get the same effect. So taking the 5 together in Protandim, the ratio that it's in, will actually make it 18 times more potent than if you were to tweak it at all and eliminate one of these herbs or take it in your own dosing. So because they were able to show that it's this specific synergistic blend, they were able to get 9 patents on the company. This one says 4, but there are 9 patents now. So you really can't patent a plant. You really can't patent things that don't work. So this is really pretty amazing. They were able to get this many patents on a natural product. So as I mentioned, it does work through this NRF2 activation. Again, just instructing our cells to make more of these enzymes to protect our bodies. I won't get into really all the science. I don't think we'll have time. But this was a really amazing paper that came out of Washington State University, and this was in the conclusions, talking about NRF2. Just to tell you how really powerful it is, it says, we may be on the verge of a new literature on health effects of NRF2 which may well become the most extraordinary therapeutic and preventative breakthrough in the history of medicine. So that's a pretty powerful statement, one that I think we really need to take seriously, and that's something that is really changing the face of health and wellness as we know it today, is the research that's going into this NRF2 technology. So let's get into canine health. This was really a huge breakthrough for the veterinary field because, with pets, we really have never, in humans, there's all kinds of talk and research into anti-aging, but in dogs, this is really the first time we've ever had this discussion, in our field about how can we help dogs age better. And, this came about because of Protandim, because people were taking it and they were finding they were having great results. And then they started to give it to their dogs, and their dogs started having great results. And so enough people started going to the company, telling the company, hey, my dog's having awesome results with this. Can we make it in a, flavored, chewable form? Because the hardest part is just getting the pill down. So the company listened and they decided to work with a veterinarian that specialized in nutrition, and they were able to formulate a flavored chewable tablet. So this is Canine Health. Works the same way as Protandim does. It's the same 5 herbs in the synergistic blend. They have added a little bit of collagen and omega-3 fatty acids to the tablet, but it works the exact same way by stimulating that NRF2 pathway and increase these enzymes in dogs. And so it reduces oxidative stress tremendously in dogs. It also supports brain, skin, and eye function, joint mobility, flexibility, and cognitive function. I do want to mention, too, that it has the NASC seal, and that's a really important thing. When people would come to me about animal supplements, I would never recommend anything that would not have this seal. And basically, the reason is because the animal supplement industry is not required to show any sort of good manufacturing practices. They don't have to prove that it's safe. They're not audited, whereas the Human Supplement Council, they do. They have to have this NSF certification to be considered safe for consumption. Well, with animal supplements, there's no requirement for that. So in order for a company to get this NASC seal, which is essentially a seal for good manufacturing practices and quality, they actually have to apply for it, and they have to open up their facility to be audited by third parties coming in to ensure they have the highest quality and the highest manufacturing practices. And if they pass the inspections and the auditing, then they're able to have this seal. So our company, being what it is, went through that process, and they were able to get this seal for LifeVantage Canine Health, which I think is a really big deal. So some of the things that I use Canine Health for in my practice are, are listed here. Definitely, skin and hair coat is a big one. It's funny because most of my dogs' patients that I would put on this, I would put them on it for arthritis or joint problems, and secondary to that, owners would come back saying, look at her skin and hair coat. I mean, it's so shiny, it's so thick. I mean, she's having these bald spots, and now we're getting so thicker hair coat, and so it's just kind of a crazy thing that we started noticing after putting animals on it. So now when I see an animal that's having skin problems or allergies or whatever the case is, I will use it for that. Definitely increased energy and endurance is a big one that I hear a lot. And that's usually one of the first things that people notice, is that their dogs are becoming more playful, going to get their toys, and just seem more energetic. Dogs that are immune deficient oftentimes improve with it. We get better sleep, better joint health and mobility, a huge one for my practice. Same with joint pain and inflammation. That's probably the most common reason I start patients on it, are the ones that are dealing with arthritis. Use it for dogs that have allergies. Tooth and gum health is a big one. There are a lot of dogs that come in that have to have, multiple teeth extractions, and those dogs are all going home with Canine Health because it has been shown in studies to reduce bone resorption, and we see a lot of that with bad teeth. Also, animals with heart disease, even kidney disease, because all oxidative stress affects all of these organs. So if there's a disease going on in any of these organs, reducing oxidative stress is going to be beneficial. Also, the cognitive related changes you see as dogs get older, if they're getting a little senile, it can actually help with that as well. Kind of pass through there. This was really cool. This was the February edition of Today's Veterinary Practice, and this is a national publication, veterinary publication, that is pretty much mailed out to clinics around the country. And you could have blown me over with a feather when I saw this. I opened it up to page 88, and look what it's talking about. NRF2, talking about preventative things that you can do to help your pet's dental problems or dental health. And they actually mention Canine Health by name on the bottom right there. You can see it. So it's the first time that I know of that a major national publication has actually mentioned our product by name. So that's a big deal, and that's something, this is going to start to be known in the veterinary community before long. We also have a canine study on Canine Health, which is really great, showing just improvement in mobility, and also showing the increase in enzymes once starting it. So again, it's very similar to what we see in people in terms of blood work. Dosing is here. It's on the bottle, but basically you dose it on the pet's weight. And when we start getting into the large and giant breeds, typically what we do in my practice is start them on Protandim, because it's just more cost effective for the owner. Going through 3 tablets a day would basically put them going through 3 bottles a month. And so typically any dog over 70 pounds, I just put them on Protandim, 1 tablet a day, and that's done great for those dogs. You can give it to cats, and the dose for a cat is 1/8 of a Protandim or 1/2 of a Canine Health. The conversion on the 2 here, so are at the bottom, is here at the bottom. So you could give 4 Canine Health. 4 Canine Health is equal to 1 Protandim. So you can sort of do the math there. If you have a medium-sized dog and you don't want to give 2 Canine Health, you can give 1/2 of Protandim. So, just depending on how many animals you have in the house, sometimes it's cheaper for people to use Protandim and split that up between their animals. These are just a couple of cases I wanted to share with you, just sort of showing you a little before and after. Well, this case, I unfortunately do not have a before, but this was the first patient that I decided to try on Canine Health. And this was one that came to me, the very first appointment. This dog, they found me on Google because I did acupuncture, and this dog is a 13-year-old female spayed beagle who has severe osteoarthritis in her hips, knees, and spine. Owners were having to carry her in and out to go to the bathroom. She required support while urinating so she wouldn't fall over. And she had a very severe lameness on her right rear leg, really non-weight bearing most of the time, had torn her cruciate ligament. So she was just an absolute mess. The owners were not ready to let her go, but we were really having that discussion, even at the first appointment of, hey, when do you know it's time? And it was obvious that her quality of life was failing at this point. And, they wanted acupuncture. I wasn't super sure that acupuncture was going to do the trick for her, but we decided to give it a shot. These were her current medications: Metacam, Tramadol, Gabapentin, Robaxin, Famotidine, and Thyroxine. So we started acupuncture, and there was a little bit of improvement. I would not call it anything significant, but when shortly after seeing this patient, I heard about Canine Health, and I knew that the owners would do anything. So we started her on it. And 6 weeks after starting, I get a text message from the owners with this video I'm going to show you. And it is sideways, unfortunately, but you can see there she is wagging her tail. She's running around doing this little jumpy thing that she did when she was a puppy. They had not seen this behavior in years. And, you know, as I mentioned before, this was a dog that could hardly walk. I mean, absolutely crazy. I mean, I just could not get over the results. And, you know, I was so excited to see this that, of course, you know, had many more patients after that I started on. And it, you know, it doesn't always have these kind of dramatic results, but I would say that 99.9% of all of the patients that I have started on Canine Health with Protandim have had positive results in one form or another. Really haven't heard anything negative. You know, I might hear occasionally where people just don't really notice a difference, but the majority people notice a huge difference. And so every dog's going to be different and when you see those improvements. But this was about 6 weeks after starting it, and we were able to wean Ellie off of a lot of her pain medications. In fact, all of them except for an anti-inflammatory that they would give her just as needed. Just to set this video up, this is Puff the Pony. This is a good friend of mine, Alice Beretta's patient. She is an equine veterinarian, and she had been treating this pony for 7 years for chronic laminitis. This pony could hardly walk, was in a lot of pain all the time, and the owners wanted to rehome him, but they couldn't do it because they were afraid that it would kill him to put him on a trailer and make him move with his feet being as bad as they were. They had tried a lot of medication. They had tried going through numerous barriers to get his feet healthier. And, you know, really, Dr. Beretta had never imagined this pony would ever walk even halfway normal. And, you know, so this was her guinea pig, and she did a little video diary, and we put it together kind of as a little movie. But she took this video before Protandim, then 4 weeks after, 7 weeks after, and then 10 weeks after. So I'm going to play that for you so you can see the progression here. Okay, so that is it. I hope that has been inspiring or informative. And again, just want to thank Jessica Crate for allowing me to share a little bit of my experience with you and my story. And I would love to hear, you know, any stories you guys have. Feel free to find me on Facebook or through Jessica. And, you know, it's always awesome to hear other people's testimonials with their pets. And also, you know, getting this out into the veterinary community. I think it's just, we can help a lot of animals with this. And so that's what I try to do, is share with my colleagues about what I'm seeing. And, you know, they're trying it and seeing incredible results with their patients too. So it's just an awesome product. If you have dogs and cats and you don't have them on it, I would highly recommend you put them on it, even as a preventative. You know, one thing I didn't mention earlier is, you know, our pets are under much higher levels of oxidative stress than even we are as people. They age much faster than us. They're eating processed food pretty much every day. They are getting chemicals put on them every month for flea and heartworm prevention. If they eat stuff off the ground, you know, and exposed to herbicides and pesticides, and So we really need to be proactive in terms of prevention because, as I mentioned, cancer is very rampant. And if you can put these guys on something that can reduce some of these things by risk factors by 40%, why wouldn't you do it? So I would recommend that for everybody, and people and animals. So I hope this has been a good webinar for you guys, and thank you so much for having me on, Jessica.